If I can say one thing is I just hope that people don't feel the stigma based around
Right.
this and that they can understand that it's not a big deal and it can really be life-changing.
My name is Dr. Tom Lavin, and welcome to the Everything GLP-1 podcast. Today I have Erin Clark with me. Erin is a GLP-1 patient and has a great story. So welcome.
Thank you so much for having me.
I want you, the whole purpose of these podcasts to try to deliver value for patients, help them see ways to maximize their results for their own self, from their own GLP-1 therapy. So I really want to hear your story. I really want to hear, how did you come to it? How did you navigate it? And how are you successful?
So I am a mom of two, 5 and 7 years old now, and probably 3 or so years ago, I think it was April of 2023, I had kind of worked through all the ways I could lose the post-baby weight.
Mhm.
I worked out all the time, would do fad diets, kind of test the waters in all the different ways, and I was still holding on to an extra probably 25 pounds. I had heard about GLP-1s through a friend and learned a little bit about compounded semaglutide and tirzepatide and things like that, and wondered more about it. So I started to do my research and decided that it was something that I wanted to try. I went to a local med spa and kind of went through the workup there, learned more about it, and started on semaglutide and started to gradually lose the weight.
That's great. So, did your provider describe how it was gonna work and, um, how to, as we say, get in the green zone and those kind of things, the food noise, the hunger cravings? Did you get all that on the front end?
Yes, she
Great.
did, and, more than anything, I just knew that I didn't feel good in my skin.
Right.
So, postpartum, I was a few years out. I was maybe 2.5 or 3 years out at that point, but my mood is directly affected by the way that I feel in my body. So I just knew that I needed a way
Right.
to lose the weight. I was snapping at my kids, snapping at my
Mhm.
husband, just generally unhappy. Um, so I knew that I needed something. And I went into the office and ended up being prescribed semaglutide and started on that. She gave me all the outline of the side effects and kind of the process and all that. And again, gradually started losing the weight and seeing some good results.
That's great. Describe your first month and your second month, because it's hard to remember back right now where you are because 'cause you've done so well, but think back the first month when you first started having losing weight and feeling better, like, you know, and any challenges you may have had, just to help patients understand this is what you're going to go through.
Yeah, in the beginning, you start and you wonder, okay, well, am I going to be sick? Am I going to see weight loss? All the things, you can, especially 3 years ago, 2.5 years ago, you there's this stigma with it. You would hear negative side effects, all the things. So I really worried of what it would be like. I would say month one, the major thing was food noise was gone. Prior, I was constantly thinking about my next meal, thinking what I was going to eat, or I would make my kids something and I would eat what they didn't eat, anything that was left on their table. I was just constantly thinking about food, especially I'm a stay at home mom. So being with them nonstop, I'm at home, I'm in the pantry,
Right.
I'm in the fridge. It's just an easy thing to pick up things constantly and continue to eat. So I did definitely, it canceled the food noise
So
and
that drive stopped for you to be eating all day long with.
for sure. Yeah,
Okay, great.
I wasn't even thinking about it. I wasn't worried about what was for lunch, what was for dinner, wasn't even when it came time for that, it was almost like, okay, like I know I need to eat and I need to eat something healthy, but I would be full faster. I wouldn't be craving things. It was
Wow.
a good feeling.
Wow. So I wanna stop and talk about food noise, because food noise is almost a concept that came out with GLP-1s. I think we didn't even know this background food noise was going on, prior to GLP-1s being able to wipe it out. So how would you describe food noise?
Really, like I said, just constantly thinking about my next meal. What what I was gonna eat, what we were having for dinner, I mean, just picking things up mindlessly. I was constantly picking up things mindlessly. So without that, it was not only helping me not eat, but, just changed my mindset completely.
Wow. Wow. And what about hunger and cravings?
Really no hunger or cravings. I was very mindful. I knew from my meeting that I needed to prioritize protein
Right.
and things like that. So I was very mindful of eating clean. I didn't want to feel bad because of what I ate. So I made sure to eat clean protein, eat vegetables, eat, anything that was going to make me feel better along with
You
my
are the
medication.
model patient. You that is fantastic.
Yeah, I will
Um,
say though, as a mom, and just me personally, I'm not a cook of any kind. I don't enjoy cooking, I don't plan meals out. So, it also was me figuring out how to do that with that lack of skill, if you will.
right, right. Wow. Um, so take us through weight loss the first month, second month, because I'm trying to think what patients that are looking at starting therapy, they wanna know, like, what did you lose first month and what did you lose second month?
Yeah, I wanna say the first couple weeks, I lost quite a bit of weight, probably faster than you should as you continue
Right,
on.
right.
Definitely felt less inflamed, um, you know, I would say probably in the first couple of weeks, maybe 6 to 8 pounds.
Wow,
Yeah.
wow.
So it
And
just immediately felt better.
yeah,
And then from there, slowed down to maybe 1 to 2 pounds a week and tapered off kind of as we went on. Because like I said, I only had 25 to 30 pounds to lose.
right.
So I would say that I met my goal within the first 5 or 6, probably 5 months, 4 or 5 months.
Wow.
I met my goal.
Wow. And the one other thing you said, which I hear from a lot of patients, just that they're not inflamed, they just feel better. Something in their whole body just feels so much better.
For sure. I was more motivated. I wanted to go to the gym more. I wanted to pick up hobbies for myself. I wasn't worried about social outings or anything like that. So it was just beyond the physical changes I was seeing. I was seeing so many mental changes. And I just felt like that was like a cycle that helped each other.
Right, right. It's interesting, the GLP-1s have so many other benefits, and a lot of them are on the mental health side and cognitive function side, but just losing weight, I mean, makes you feel so much better. You can't separate how you feel from, your physical from your mental. They're connected.
For sure.
So
I agree with that.
that is great. So 4 to 5 months, you're at your goal weight, crushing it. What's your plan then?
Somewhere in between there, I think some of the laws changed, or maybe it was a choice. I can't remember from the place that I was receiving my medication, but I ended up switching to tirzepatide.
Okay.
So I actually did see more progress during that switch to
Mm,
tirzepatide. I felt like I had a little bit less side effects, was dropping weight a little bit quicker than I was previously, hit my goal weight, and started to kind of understand the medication, understand how I could dose appropriately to feel good but still see progress. So as time went on, I think I went to more of a maintenance dose, if you will. So I didn't continue to increase, um, based on how I was feeling or what was
right,
going on. Sometimes maybe I would go 10 to 12 days between my shots, or if I felt like I had a vacation coming up or something like that, I would be more diligent about it. I also realized that once I had taken this for a while and I wasn't increasing my dose, it wasn't quite as much of there's no food noise or anything like that. Some of it came back a little bit because I wasn't increasing, but at that point I had learned how to eat appropriately.
right.
I had trained my mind to choose protein and to choose the healthy foods.
So you were already establishing your habits, but so you kinda, as we said, fell back in the yellow zone, but you'd established your habits so well and were still on the lower dose of GLP-1 and at your goal weight. So and that's only in 6
I
months?
would say probably 6 months.
Wow, that's fantastic. Um, what a six-month life change.
It was amazing. I truly I mean, being a stay-at-home mom and having 2 young kids and just the stressors that come with that to
Right.
start with.
Plenty of stresses without fighting your weight.
Yeah,
Yeah.
so it was just I mean, my husband will even say that our life changed when I went on them because
Yeah.
my attitude changed, my mood
Yeah.
changed.
When mommy's happy,
Yes,
the world is happy.
for sure,
Everything is perfect. And quite frankly, moms have the biggest challenge in the world. You got to maintain everything. So that is great. So 6 months your goal weight. I love the fact that you kind of took over your care with you'd been given the tools. I always tell patients, you know your body better than me. You can listen to the signals from your body and changing your dosing to going from 7 to 10 or 12 days. um, that was on you because you knew to maintain the weight you didn't need it that frequently. You didn't need to bump the dose, and we see that happening all the time with patients. And I think it's fantastic because it's you taking over your care with still with guidance and oversight or help if you need it, but you figured everything out.
for sure. I continued to, do my weigh-ins and figure out, where I was with my BMI and all of that, but really was able to adjust based on what my life was like at that time. So since then, I've continued, this through this, I guess, 2 years since I met my goal weight. I have stayed on more of that maintenance plan or microdosing. Maybe you can speak more to what microdosing even means. I feel like that's kind of like a hot word
It's a
these days that I
buzzword,
see
yeah,
everywhere. So I'm not sure if I'm microdosing or maintenance, but I've just really learned the dose that I need to take for the time.
right. Microdosing just to is basically something that, was previously more of a drug-induced term for, mushrooms or, LSD or something like that, but it kinda got brought over into the GLP-1 therapy, and some people love that term, some people hate that term. The reality is you're staying on a lower, maybe a subclinical dose where you're not gonna be losing weight. You'll still have some of the hunger and cravings, but you're getting all of the other benefits in the body, such as the broad scale anti-inflammatory changes, um, probably slowing aging due to healthier mitochondria and less reactive oxygen species and less full body inflammation. Um, and then all the brain pathways and mesolimbic pathways where you're more in control. It's more of an executive control over impulse things like drinking or even scrolling on the internet or binge eating. You're in control. So
That
those are
is one thing for sure that I noticed too, especially in the beginning when I was first taking it. I used to enjoy a glass of wine at night or 2, after being with my children all day, and
yeah.
it kinda takes away the desire for that even.
Yeah. Yeah, I find people still enjoy it, but they're not driven to it.
Mhm.
So they have no problem not drinking, and then if they have to drink or they go out to a party, they still enjoy it and they
Right.
love it. But, breaking that habit of cracking open a bottle of wine every night, which I feel like everyone gets into with children and
For sure,
life.
and post-COVID, I just feel like that
And
was
post-COVID,
yeah,
yeah. COVID really impacted that greatly also. So, no, I think it leads to so many other things out, in addition to the weight loss.
for sure.
So, so congrats. I mean, you've done fantastic, and you know, your story helps a lot of other people, and their path won't be identical to yours, but a lot of things will be. That's why we always stress kind of the personalized, customized care. There are not two patients that are identical from, a genetic standpoint and an environmental standpoint. So we have to take patients where they are. I don't care about all the macro concerns. I care about that patient, getting them from where they are today to their goal, with them partnering with me and making sure they have all the tools and understanding to listen to their own body and help with the whole care along the way.
For sure. I will say one thing that I also wanna mention is I feel like there's such a stigma with this, especially 3 years ago.
Right.
Once I decided to start, I only had maybe 1 or 2 friends who had tried it before or 1 or 2 people that I knew, and, as I started to lose weight, of course, people notice, "What are you doing? You look so good," and I was going to the gym all the time prior and post starting, on the medication, and it kinda got to the point where I was like, Do I tell them that this is what I'm doing, or do I just say, "Oh, just diet and exercise?" But I ultimately decided it's been such a life changer for me that it's important that people know that there is the option.
Right.
And at this point, I mean, probably more people I know are on it than not on it.
Those are a bunch of important points. So the whole shame thing that, oh, you took the easy way. No, it's not the easy way. It's the one effective way that'll help you get there. But you have to make the changes. You have to exercise. You have to make sure you get your protein. You have to stay hydrated, work on your sleep as best you can with little kids, and do the other things in addition to taking the med, but the GLP-1s will get you there and help you establish that long-term success.
I think that's why there probably is a little bit of stigma is like you're worried people are going to think, oh, well, she just took the easy way.
Right.
She just took this medication and now look how great she looks. But like she didn't do anything for that. But really, in
So false.
reality, like you're making great food choices.
Right.
I was still working out. I picked up hobbies. I now play tennis, which I'm obsessed with.
Awesome.
I play golf. I do all kinds of active things. And
Right.
this is all kind of a result of me feeling better in my own skin.
Right. Right. Yeah, I tell patients, it's about you. We don't care what anyone else thinks, and like you said, at this point, 10 to 12% of the American public has tried GLP-1s. So this is not a secret anymore. Like, they're out there. They are the one thing that can change. Um, I tell everyone this is a chronic disease that has multiple neural and hormonal pathways that try to keep you at that heavier weight, and the GLP-1s break that cycle and then put the everything in your corner as far as losing the weight and keeping it off. It's certainly not the easy way, but the one way you can absolutely do it and change your entire life.
Yeah, I agree. I certainly have no plans on stopping this path anytime soon. So I've very much so enjoyed it.
Yeah, and your story impacts so many other people that are stuck, post baby, 30, 40 pounds, 25 pounds they can't get rid of. They're doing everything. And that people don't understand that, but we have all these pathways in our brain. Like I said, they're neural, they're hormonal, that try to keep us. We always talk about the set point, and the GLP-1s break that thermostat in your brain that tries to keep you at that heavier weight, breaks that and brings it down to a level where you can be healthy, lower weight, feel better about yourself, less full body inflammation, and really living life.
For sure. Yeah, and postpartum, I'm sure there's some medical information about the hormones and all the things and what GLP-1s can do for that, but it definitely made a huge difference for
Yeah,
me.
that is fantastic. You are the ideal patient. Like, you're the model, like, you know, that 20 something, 30 something that really hadn't battled with their weight before. But now, after babies and their hormones getting all out of whack and carrying that extra weight, you're stuck with the 25 pounds.
Yeah.
And this can bring you back to where you were before.
Yeah, and I also think when I've taken breaks and things like that, it's not like I've gained all this weight back because that was almost like it was the baby weight, you know?
Yeah.
It wasn't my starting weight prior to the babies. It was my extra weight from that pregnancy and my hormones changing and all the things. So, um, I think being at the lower dose and all that, it's not like I've gained anything. I've maintained my same weight, even lost a couple more pounds, things like that.
Nice. And your habits are, I mean, picking up tennis, picking up golf, and just being that active living life is just amazing.
For sure.
So these GLP-1s they found out are very effective for weight loss, but nobody knew, is it a short time thing? Do you take it the rest of your life? Do you change your dosing? Do you cycle on and off? There were no trials on what is the long-term strategy. And in my mind, your biology is set up for carrying that extra weight. So Now in you, it was baby weight, but there are a lot of people that have been overweight for 20 years, 30 years. And so their body is really programmed heavier, and that's kind of a chronic lifelong condition. The GLP-1s can help them lose that weight and lower that set point in your hypothalamus, but the long-term strategy probably involves some aspect of GLP-1s, whether it's cycling on and off or whether it's a lower dose, whether you call it a lower dose or microdose, it's all semantics, lower dose GLP-1, and then you get the benefits of all the other pathways that GLP-1s are effective in. The they're all incredible, but the cardiovascular impact of avoiding the plaques, lowering the liver's production of something called VLDL, which delivers cholesterol to these plaques in your heart and decreasing inflammation, lowers your cardiovascular risk tremendously, and that's the number one killer of people in America, worldwide, essentially. So just for the cardiovascular benefits, low-dose GLP-1s have a tremendous benefit outside of all the neuroprotective, Alzheimer's prevention, dementia protection, um, and full body inflammation impact that we know GLP-1s have. And a lot of people will say, well, there's not been any randomized long-term trials. Okay, right. So by the time the randomized long-term trials are done 10 years from now, you miss 10 years of taking what certainly appears to be a very safe peptide that has long range, long-term implications that can dramatically impact your health. So my feeling is these are long-term peptides for most people, and I feel it'll be an expanded field with the addiction treatment, the cardiovascular benefits, and the neuroprotective benefits, and the cancer prevention. So that's my
I
thought.
love hearing all that, especially, I mean, 2 young kids that have to be around for a long time,
You
lots of
do.
family history, with cardiovascular problems, dementia, things like that as well. So, I mean, I'm here for it.
I love it.
Everybody I know who has gone down the same path as me has very much so enjoyed it and seen very similar results and feels the same way about the mental effects, the physical effects, all the things.
Right. I think everyone has an ability to impact people in a positive way, and these peptides are so life changing. And with you doing it, it breaks that, whether it's shame or fear that they're worrying about taking it, or will it work for me? So you at least can tell your story and then let them make the decision based on their own facts.
Sure, because I think people are worried, you're taking a little needle and injecting
Right.
this into your body. So I think that in itself can just seem nerve-wracking to begin with
Right.
until you either know somebody who's done it or seen results or gotten all the information and started it yourself. I understand the hesitation in the beginning for sure.
Sure. You went through it.
For
Yeah.
sure.
It's very important that you just simplify this process. Life is complicated enough with small children, marriage, work, everything. So we really try to simplify the process. And the process is do whatever works for you. We'll make recommendations, try to get this much protein, try to get this much hydration, try to avoid ultra processed foods. But in the end, we've got a goal. Help you lose your weight, get to a healthy weight, and get there as healthy as possible, and live your life. So there's not this crazy turmoil of change that comes with getting on a GLP-1. Just guidance to do it safely and effectively, and have good results. And you did it.
Yeah, I agree. And it's been a wonderful process for me. Much less consuming than I thought it would be, simply taking 1 shot a week. And that's really, you don't really have to do any thought after that because your brain's not telling you to eat, eat, eat. You're not worried about a bunch of things. So it really is a simple process.
Right.
and I've really enjoyed it.
That's great. Well, we appreciate you coming on and, sharing your story. I know, you guys are private, but this does impact a lot of people, and there are a lot of people wondering if it's right for them. And I really see GLP-1s as the peptides that are, very safe, and they can impact people in such a positive way.
If I can say one thing is I just hope that people don't feel the stigma based around
Right.
this, and that they can understand that it's not a big deal, and it can really be life-changing.
That's great. Our discussion today with Erin is certainly not medical advice. We tell everyone to have your own medical provider overseeing things, and managing your care. We wish everyone the best, and our goal is just to impart information that'll be helpful for you to optimize your weight loss and health long term.